So hopefully everyone was able to join in your prospective language room. We apologize again for that technicality issues, but I hope everyone was able to get into the room that you hope you can get in. Again, just pick on the globe and you can join the room that you want in whatever language you wish. We know most of us are familiar with Zoom. However, we want to share a few feature items with you. The presenters will use the chat feature to share links and additional resources and information with you. Please use the question and answer box to ask your questions. At the end of the presentation, we will verbally respond to your questions. We will try to get as many questions as possible within the Q&A session. There will be no written responses providing throughout this webinar. There will be no certificate or credits provided for this webinar as well. You can also obtain a copy of this PowerPoint slide in English, Chinese, or Spanish from our DSS website under Resources for Providers. The PowerPoint slides are again in multiple languages. The webinar will be recorded and posted on the DSS website at a later date. Again, please check the DSS website under Resources for Providers to get a copy of our PowerPoint slide, as well as the recording of this webinar at a future date. So let's move into our agenda for this evening webinar. Again, we want to really thank you for joining us tonight. My name is Jane Kong Huynh. I will be one of the presenters for this evening webinar. We are excited to present our first statewide child care provider webinar of 2024. Thousands of providers have participated in our statewide webinars over the last few years, and we look forward to sharing more information with all of you throughout this year. Here are our agenda for this evening webinar. First, we have child care program updates. Then we have some very special guest speakers joining us this evening. From the California Child Care Resource and Referral Network, who will be explaining their role and resources referral programs for parents, provider, and the larger child care community. Then we also have our guest speakers from the Department of Healthcare Services to provide information about the new virtual children and youth behavioral health platform designed for parents, caregivers, and kids called Bright Life Kids and Saluna. Next slide, please. Here are some child care licensing program updates regarding recently released guidance. PIN 24-01 CCP, implementation of single license child care center right requirements and related updates. The provider information notice provides information on the recent approval by California Office of Administrative Law of regulatory amendments for a single child care center license for a new licensing applicant. Next is PIN 24-02 CCP. Written directives for the care of toddlers in licensed child care center pursuant to AB 2131, Chapter 910, Statute of 2022. The provider information notice established written directives requirement for all child care center licenses for the care of toddler-aged children pursuant to the authority of Assembly Bill 2131, Chapter 910, Statute of 2022. The department will issue written directive to provide additional health and safety guidance for operating with a single license, including the commingling of toddler with infants or preschool children. And we also have PIN 24-03 CCP, frequently unannounced child care licensing inspections. The provider information notice information child care provide about the frequency unannounced child care licensing inspection as established under the California Child Daycare Facility Act, Health and Safety Code, Section 1596.70. Again, If you have more questions about these pins, we have also posted them in the chat. And please reach out to your licensing program analyst or your regional office for additional information. Next slide, please. Since these webinars are offered only quarterly, we want to highlight some observations between now and our next time together. In April, we observed Autism Awareness Month, the National Autism Awareness Day taking place on Tuesday, April 2nd. Child Abuse Prevention Month and the Week of the Young Child is from April 6th through the 12th. May is Mental Health Awareness Month. We know that there are many other important awareness campaigns that we are equally worthy of nothing, but we want to note and take this opportunity to note these special preventive activities. Next slide, please. Strengthening Family Protective Factors Framework. The protective factor is a set of characteristics that can be present by both family and community level. When these factors are present, they reduce the risk of adverse childhood experiences, also known as ACE. Like child abuse, neglect can improve overall well-being of children and families. How do we prevent child abuse and neglect? One way is by increasing the protective factor. The protective factors are conditioned in families and communities that, when present, increase the health and well-being of children and families. These attributes serve as buffers, helping parents find resources, support, and coping strategy that allow them to parent effectively, even under stress. Research has shown that the protective factors are linked to a lower incidence of child abuse and neglect. Next slide, please. At this time, we want to discuss about the 5 protective factors to strengthening family. Parental resilience, social connection, concrete support in times of need, knowledge of parenting and child development, social and emotional competence of children. Strengthening families is a research-informed approach to increase family strengths, enhance child development, and reduce the likelihood of child abuse and neglect. It is based on engaging families, programs, and community in building 5 key protective factors. Parental resilience, managing stress and functioning well when faced with challenges, adversity, and trauma. Social connections, positive relationships that provide emotional, informational, instructional, and spiritual support. Knowledge of parenting and child development. Understanding child development and parenting strategy that support physical, cognitive, language, social, and emotional development. Concrete support in times of need. Access to concrete support and services that address the family's needs and help minimize the stress caused by challenges. Social and emotional competence of children. Family and children interaction that help children develop the ability to communicate clearly, recognize and regulate their emotions, and establish and maintain relationships. At its heart, strengthening the family is about how families are supported to build key protective factors that enable children to thrive. The 5 protective factors at the foundation of strengthening family also offer a framework of changes at the system, policy, practice level, locally, statewide, and nationally. That's a lot of information to share, but we thought that this is very important information to share with all of you. Next slide, please. At this time, we are very, very excited to have such a wonderful guest speakers joining all of our webinars tonight. So we would like to introduce our first group of guest speakers from the California Child Care Resource and Referral Network. We have Kelly Guesh, Director of Member Services, Sadie Ayala, Resource and Referral Program Supervisor, Family Resource Center of San Joaquin, and Angie Sanchez, Child Care Community Liaison and Option for Children in LA County, and some other guest speakers as well at this time. So welcome.
Thank you, Jane. And we'd like to thank the CDSS Child Care Advocate team for inviting us to share with all of you tonight. And thank you to all of you on the call for the work that you do with children and families throughout the state. Tonight, we're going to provide a brief overview of child care resource and referral services. The services at R&Rs are broad, and there are a lot of them, so we'll be able to go over a high-level overview. Like I said, it'll have to be brief to get through the amount of information that we have. And so next slide, please. On this side, you can see that the Child Care Resource and Referral Network in California is one of the oldest and most well-established systems of child care resource and referral agencies in the U.S. In fact, many of the agencies are celebrating 45 and 50-year anniversaries this year. R&Rs have tons of local knowledge, and the R&Rs have been recruiting, supporting, and championing childcare for all of these years. Many staff at R&Rs come from the childcare field. In fact, I was a childcare provider. I had a family childcare home that I owned and operated many years ago. So my heart is with all of you. And there is at least one state-funded child care resource and referral serving every county throughout the state. They are there to meet the child care needs of children, families, and child care providers, as well as the communities. And just a little bit, going back to what Jane was talking about with strengthening families, R&Rs have adopted the Strengthening Families framework also to help them guide their work with children and families, as well as child care providers. But let's take a deeper dive into what child care resource and referral does throughout the state. And so I'm going to pass over, we'll go to the next slide, and I'll pass it over to Miriam.
Thank you, Kelly. Hi, my name is Miriam Ibarra with Options for Learning. I would like to talk a little bit about the heart of R&R. In R&R, we help families find childcare that meet their needs. We connect with the providers and help them provide quality childcare through trainings, technical assistance, and support. We are here for you and provide resources. The information we gather help us tell the story of childcare by showing what families want and need. R&R offer resources for families to learn more about other community services that are available to them. The next slide will be presented by Sadie. Next slide, please.
Hello, everybody. My name is Sadie Ayala from Family Resource Center. I think we can go back one slide. Okay, we can move forward. So for the child care referrals that we offer in our R&R programs, we offer them online or through direct contact with families. We also sometimes do it through calls directly through R&Rs, and sometimes we do that online. Some of the basic referral information that we go over and that we require families to go over with us are what you see on the slide. So things like location, hours, the reason for care, the type of care. And so we do this to be able to provide with quality referral for the families that are trying to find childcare. Something that I should mention is that we do not share addresses when we do the referrals, and the referrals are emailed to the families as well. It is important that we receive accurate information from providers to be able to best serve the families. And then if we can move forward to the next slide. And so, like I mentioned before, R&R provides families with all the information about the child care that is available in the areas that will best meet their needs. And we also, again, reiterating how important it is to update child care program information for our referral process. So I'm going to go ahead and take it back to Miriam.
Thank you, Sadie. Parent choice and resources. So the referrals are based information provided by the family and services reported by the child care programs and are randomized with each referral. With that being said, as Sadie mentioned, it's important that child care programs update their vacancies, information such as hours and services they provide so the R&R can provide the accurate information to the parents. Parents will choose a child care program that best fits their need. The resources and referral do not make any recommendations. Parents also have the right to receive information regarding any substantiated or inconclusive complaints about a licensed childcare program. The childcare resource and referral will also provide the contact information for community care licensing, where the parents can view and request that information. We also help families to find other resources that are available to them, such as WIC, Health and Wellness Program, Housing, Utility Assistance, Child Development, and Parenting Programs. The next slide will be provided by Angie Sanchez. Next slide, please.
Thank you so much, Miriam. My name is Angie Sanchez, and I am from Options for Learning, and I am the Child Care Community Liaison. So we are here as an R&R, we are here to support you and your business. R&Rs have been supporting providers for over 40 years. R&Rs can help you connect families to childcare programs if the program participates in the R&R referral system. You can always check the mychildcareplan.org, the statewide consumer education website, to see if your program is listed in the referral system. If it is not, or if your information needs to be updated, please contact your local R&R. The R&R agencies can also help you connect to a sponsor to a family child care food program who will then offer training for you and your staff and your assistants on how to provide basic and very nutritious meals to the children. We provide health and safety reimbursements for CPR, first aid, and preventative health practices, and we connect you to other professional development opportunities. We offer trainings in various topics, such as dual language learning, special needs, marketing, and it's definitely something that we do support our providers with. We listen to the type of topics that they need training on, and those are the trainings that we offer. We offer also resources for your programs and the families that you serve. Next slide, please. Other childcare resources and referrals also recruit and support childcare in their communities. We also have the SIP program. The SIP program offers recruitment, TA, and support. We support from the start when you are first thinking about childcare and to see if it's a good business fit for you. We help you to learn how to budget and business development, how to create contracts, how to market, and how to set up your environment. We offer the one-on-one and group support. We offer free trainings and workshops. We offer incentive, very dependent on available funding. And we also support our family, friends, and neighbor caregivers. Next slide, please. So the biggest question is, how do you find your local child care resource and referral agency? You can do that by visiting the R&R network website at rnrnetwork.org and enter your zip code. And there you will be able to find your local R&R agency. And we definitely encourage you to contact, if you have not already, contact your local R&R agency so they're able to explain to you and definitely share all the different things that they're able to offer you. As well as an agency, we can also offer you any PPE distributions we will be having. If you need anything, like I said, please do not hesitate to contact your local R&R agency. Thank you so much. And now, I'm going to bring it back to Kelly.
Thank you, Angie and Sadie and Miriam, and for the work that you do every day to support childcare providers and children and family in California as they provide or search for childcare. So just a little bit of a recap. There is an R&R in every county, and they help to bridge families to childcare. And so it's very important that you update your information with your local resource and referral agency, as well as My Child Care Plan. That connection is what helps to create a quality referral. That way, when a family is searching for, let's just say, infant care, we're not giving them referrals to school age only care. And so it's making that connection, and it's all based on the information that you provide. R&Rs are your partners. They're there to support you in the work that they do. They're collecting data, asking questions, so that they can tell the story within their own communities, your communities. By asking parents what they need and by finding out what you provide, it helps the R&R to tell the story locally, statewide, and even nationally. That all helps us to fight and to advocate for more money at both the local, the state, and the federal levels. So even if you don't sign up for referrals with your local R&R or with mychildcareplan.org, please share your information so that your R&R knows what you're providing. Let's work together to meet the childcare needs across California. And don't forget, for more information, contact your local R&R. We value the hard work that you do and the dedication that you have for children and families, and your work makes a difference. So thank you, everybody, for all your work.
Thank you so much for that information. Thank you, Kelly, Sadie, Angie, and Miriam, for that very informative information. We have always been working with the Resource and Referral Agency, so please contact them if you have any information or resources you need for your childcare program. Now we would like to introduce our next group of guest speakers, who will be sharing information regarding to the new behavioral health virtual services platform for youth, parents, caregivers. Please welcome Sheila, Sabrina, and Kyle. They will be sharing their PowerPoint slide at this time.
All right. Thank you, Jane, for that very kind introduction. Good evening, everyone. My name is Sheila Abuke. I am the Chief of the Behavioral Health Digital and Operations section with the Department of Healthcare Services. Before getting into this evening's topics, I'd like to just quickly thank our CDSS partners for inviting us today to today's webinar. We'll quickly level set on the agenda items that we're going to provide. We are going to go through the behavioral health virtual services platforms. Also with me today, I can introduce you to our Bright Life Kids and also Saluna partners, where they can then go through their overview of the services. And then we'll also share out partnership opportunities. And if anyone has any questions, there are a couple of QR codes that you guys can scan, where we can definitely assist in all the questions that you guys may have in this evening's webinar. I'm really excited to share with the group that the Department of Healthcare Services launched 2 new and free digitally enabled behavioral health service apps. We have the Bright Life Kids app that is designed for parents and caregivers with kids ages 0 to 12. And then we also have the Saluna app that is designed for teens and young adults ages 13 to 25. The services are designed to meet the diverse needs of all families and children, teens, young adults, and also their caregivers, regardless of insurance coverage or immigration status. These platforms are really just one piece of the whole pie of the governor's master's plan for kids' mental health, and is also part of the Children and Youth Behavioral Health Initiative. The strategies that the Children and Youth Behavioral Health Initiative is really implementing and including the launch of these two platforms are really creating the foundation and developing the infrastructure to really support a more coordinated, youth-centered, equitable, prevention-oriented system in which young people and also parents and caregivers can find the support that they need when they need it and where they need it, and also in the way that they need it most. In this next slide, I'm going to pass it over to my team member from the Brightline team, Sabrina, to go over the overview for Bright Life Kids.
Great. Thank you, Sheila. Good evening, everyone. My name is Sabrina Sandala Lee, and I lead the promotion and engagement efforts for our new program with DHES, Bright Life Kids. And also want to give a quick shout out to my colleague, Cynthia Rodriguez, who's here, our community engagement lead. And she talks to parents about the program every day, and so she can say hi to chat and also post any key links as well. So it's our honor today to talk to you about how we're building a brighter future for California children. Again, this is the ages 12 and under program. And afterwards, my partner, Kyle White, will talk about Kooth. So on the next slide, as you already know, and what Sheila has already said, Bright Life Kids is designed to be accessible for all, regardless of your income, insurance status. There's like no referrals needed. It can be accessed virtually through any phone, tablet, or computer. We have bilingual coaches in English and Spanish, and our services will be delivered in 17 other languages through interpreter services. And our behavioral health experts help children with an array of issues ranging from sleep troubles, social emotional well-being, to self-confidence, to school stress and bullying and friendship difficulties. And we're also here to help support prevention and wellness before any of those issues actually arise. And I know this slide can't contain everything we can help children with because we support so much. And I know many of you work with children. And as we go through the slides today, would love for you to consider the children in your guys' lives and their needs as we talk about the program. And with this great news resource that's available to you, one question we wanted to make sure to answer for you today is, how does Bright Life Kids fit into the existing care delivery model? So your licensed therapists and physicians typically focus on managing specific presenting concerns and symptoms, typically higher needs and acuity represented in the top gray at the top. And below, represented the white yellow space, is where most kids are at. Bright Life Kids focuses on prevention and early intervention so that children are supported before they require diagnosis and clinical intervention. So we're reducing the likelihood of progression and escalation into clinical care or emergency care. And so we want to partner with all of you here to let families know that this offering is available to them, and we want to normalize the conversations around emotional health so together we can build a strong and steady foundation for our youth. And on the next slide, this describes how Bright Life Kids supports children through the very formative years, 0 to 12, when we know there's so much development, growth, and change that's happening at a very quick pace. So in their early years, we have our newborns and toddlers, where we support parents through our parent management training, PMT, assisting them to understand their child's development, establishing effective routines, navigating through the challenges of the big emotions and the tantrums. And as they get older, children's ages 6 to 12, our dyadic coaching comes in and involves both the child and the parent. And our coaching sessions cover very essential skills for navigating interpersonal relationships, fostering academic success, and just managing the transitions within the family dynamic. On the next slide, I'm going to double click into how Bright Life Kids can deliver care to your organization's families through our digital tools, our behavioral health coaching, and care coordination. So for digital tools, based on your child's age and needs areas, you have access to tailored content recommendations, including articles, podcasts, and exercises. For behavioral health coaching, our coaches use live video sessions so that they can guide the children and parents through, whatever behavioral health issues arise. Or if they prefer, like me, sometimes if you want to reach out to a coach and just do secure chat, it's as simple as just typing a question like, hey, my kid is having separation anxiety. When I drop them off to school, what do I do? Or, hey, I'm having a hard time setting boundaries with them on screen time. What do I do? And then lastly, care coordination, making sure every child is getting the support they need, whether it's through Bright Life Kids or somewhere else. And our specialized coaches evaluate the needs of the family and determine the right kind of care and help families get connected to support. And on the next slide, we have a great video for you that hopefully that works if you play that, Sheila, that will take you through the Bright Life Kids experience.
And Sabrina, maybe just for the sake of time, what we can do is drop the video in the chat for participants to access on their own time. Just because I know, again, I want to make sure that we also have time to get through our other components, but definitely we can send that through the chat so that participants can take a look at it.
Yeah, definitely. I'll pop it in the chat. And without further ado, then I'll hand it over. I believe I'll hand it over to my colleague, Kyle, to talk about Saluna 13 to 25.
And hey, everybody, I'm Kyle White. I'm the Customer Engagement Director here at Kooth. We are the provider of Saluna and work really closely with DHCS to help ensure overall success of the program as we launch here in California. So excited to share some more information today, and we can go to the next slide. So want to start out with a little bit of background about who we are at Kooth. We were founded over 20 years ago in the UK and have since provided close to 11 million youth under the age of 25 access to mental health and wellness resources. We've done that through over a million professional hours of support provided by our team for behavioral health coaching and other resources for those youth, and have since expanded outside of the UK and are launching here and growing our team in California and really across the US to expand these efforts. One thing I want to note about Saluna quickly is it's really also, Saluna is a product of the youth voice. It's been co-designed with youth to really be what they need in a behavioral health support, a free, safe, and accessible space where they are empowered to positively manage their mental well-being. So we could go to the next slide, Sheila, and you'll get to see a little bit of the youth voice actually and how it shaped the app here. Actually, everything from the color scheme to the nighttime sky constellation theme throughout the app all comes from youth feedback in terms of something that made them feel comfortable to continue coming back and utilizing this for behavioral health support. So on this slide, you'll note that we've structured our supports as a multi-tiered system of support, similar to what may be found in schools. So just starting out at that first tier, this is really looking at self-guided resources and universal support. So we're really focused on fundamental practices such as healthy habits, goal setting, and personal reflection through journaling to be able to serve as that foundation for overall well-being. Second tier provides that additional content and peer support community for the users. So this is really adding in additional activities, discussion boards, helpful articles from our content teams and other users. One thing that we learned from our users in the research is that young people feel most comfortable being able to contribute anonymously. So they are able to access everything in here anonymously. And while it's very important to prioritize the anonymity of our users, it's also really, safety is very key to what we are doing here and a big priority. So anything that is user generated is pre-moderated. So we have a team that is vigilantly monitoring anything that is posted to ensure a positive and effective environment through that pre-moderation, and ensuring that nothing is posted live until it's been approved to meet our community standards and is safe for all users to be able to see. So that kind of shifts this away from typical social media and other places online where we know that it's going to be a safe, kind, and appropriate space for our users. Transitioning into that third tier, this is where we add on an extra layer of specialized assistance and professional support through our coaching features. So we have behavioral health coaches available to provide sessions and guidance tailored to the individuals who are seeking one-on-one support through either booked or drop-in sessions. Drop-in sessions would be with the next available coach, and booked sessions, the user can actually select a coach based on a number of traits and characteristics to ensure that they feel comfortable and have that shared experience with the coach if that's what they're looking for. This tier also provides a searchable repository for users to be able to explore on their own or dive into with a coach if they choose, of off-platform resources within their community to get additional help as well. We could go to the next slide, Sheila. So we'll go quickly through here. This is very similar to what Sabrina just covered related to Bright Life Kids, but emphasis is really that the model is subclinical and focused on early prevention and intervention. Difference being we're obviously focused within that 13 to 25-year-old age group versus the 0 to 12. But Sheila, we can go ahead for time's sake. All of everything we've been talking about here is really serving as Soluna being able to be that digital front door for when additional support is needed. So as noted, these services are subclinical and preventative in nature. In the case that Soluna is identified, if our coach thinks that Soluna is not the right solution for the user, we're going to provide a bridge to be able to connect the youth to the right support to meet their need. Our clinical team knows, and our clinical and service delivery teams are very well aware of the value of the existing supports and relationships within schools and organizations and just any other organizations that the youth may be receiving support from. And they're likely to encourage the youth to connect with trusted adults and resources within the school and community. So ultimately, we're not going to point them away from existing supports and are really going to encourage them to lean into those. We view this as a true partnership to make sure we're getting the youth the right support that they need. We could go to the next slide, Sheila. Thank you. So it's really important to note again that safety is at the core of everything we're doing, from that pre-moderation I was mentioning before, which allows for not only to ensure that it's safe for our community standards, but can also look for risk identification and intervention if needed based on what the user is posting to their journal or to the community. The anonymous service model, which is really focused on providing that safe space for the environments for the users to be themselves. Everything that we're doing is really focused on the safety of our users in every interaction on the app. We, of course, adhere to all local, state, and federal guidelines as far as reporting and regulations. Ultimately, our safety measures are there to prioritize the autonomy and empowerment of our users, and our model allows them to be really in control of their well-being. And we could go to the next slide. So one thing we always like to let folks across the state know is that any stakeholders working with youth, we both ourselves at Youth and Soluna and Brightline with Bright Life Kids, try to make it as easy as possible, just knowing that how limited your time may be. So we try to provide as high impact and low lift resources to really provide guided support throughout the entire journey. We also have teams on the ground throughout the state to provide guided support as well. So we have teams that are happy to come out, present to either folks in person or present to youth in person when possible. So we're really here to support the overall engagement across the state and make it as easy as possible for anybody else who's sharing information about the programs to do so. We could go to the next slide, Sheila. I think it may be a similar video. So we can drop the video slide or link in here. Yeah, let's go ahead and just skip past it. Great. So on that note, related to partnership opportunities and next steps, Soluna and Bright Life Kids both offer digital toolkits that have assets, websites, email templates, a ton of information to help get the word out to the youth that you work with. Printed materials, we can provide ongoing strategic meetings, like I said, with our team that is on the ground throughout the state. And we can, of course, provide virtual in-person support as well. If you go to the next slide, we actually have a couple of QR codes and websites here that you can go to either access those digital toolkits or be able to reach out to the Soluna and Bright Life Kids teams to get directly in contact with us. And I think that's all. I think that's our last slide here. So I can turn it back over to Sheila.
Yeah, sure. Thank you, Sabrina. Thank you, Kyle. I'm going to leave the QR codes up here for just a moment, and then I'm going to go ahead and pass it over back actually to Jane.
Okay. Thank you so much. Wow, that's a lot of information, wonderful information. Please check the chat. I'm sure that Sabrina and her team have added a lot of information in the chat for you if you didn't catch all the information that were presented. But again, that is very, very exciting information that you have just shared with us regarding to Brightline Kids in Saluna. We were unaware of that until now, so thank you so much for being our guest speakers and sharing that information with us. Again, we would like all of our guest speakers to remain with us until the end. So when we start our Q&A session later on, if you do have any questions for our guest speakers, please enter in the Q&A. We will verbally address those questions at the end. So at this time, we want to take this opportunity to make intentional space for strengthening for justice, equity, diversity, and inclusion related to information and resources. Here are a couple of strategies for incorporating JEDI in your program. Please create activities that allow children to share details about who they are, their culture, and their background. Provide various books, dolls, toys, and learning material highlighting characters with diverse backgrounds, mental and physical qualities, religions, and more. So please be creative in your classroom and create all these wonderful activities for your children and for your families. Next slide, please. Before we provide you with additional general information relating to licensing and statewide webinars, we also want to make a special space for tonight's webinar to mention that May 10th is National Child Care Provider Appreciation Day, and to celebrate our child care providers, educators, and provider workforce. We want to celebrate and to acknowledge the important work and the positive impact of high quality childcare that can have on children throughout their lives. We understand that each day, thousands of parents rely on childcare providers to maintain a safe environment for their children while they are at work, at school, etc. Other parents choose to send their children to a childcare provider to receive quality care and education to prepare for school. Research shows children undergo rapid growth in physical, cognitive, and psychosocial development during early childhood. And since many children spend most of their waking hours with a childcare provider, it is important that it be one offers safe, healthy, and nurturing care during the early childhood years. It takes a special person to work in the childcare field, so it is important to show appreciation to these individuals, including those who you may not even mention or have in mind, such as teachers, cooks, bus driver, director, administrator, and other staff at the childcare centers, childcare family homes, and affiliates agency that support the childcare community. So tonight, we want to thank you and appreciate you and celebrate you not only on your special day, but every day. Next slide, please. Staying connected is very important to all of us. Please review and update your contact information as well as having your email address on file. Let your licensing program analyst or your local regional office know when you have changes to your phone number, email address, changes of your location, any changes to your operation and or physical plan. A link to the local regional office contact information is on this slide, as well as on our DSS website. We will also be adding this link on the chat as well. Next slide, please. Please be informed and keep up with the current licensing updates by registering to be on the distribution list. Once you are on this list, you can receive licensing updates through provider information notices, also known as PINs, sent directly into your email inbox. From DSS homepage, you can click on the blue tab link that said Received Important Updates, or you can use your camera to scan the QR code on the right of this page to register to be on our distribution list at this time. We will also be placing the link to this webpage in the chat. We will wait a few seconds at this time for those that want to register. Please again scan the QR code with your camera so that you can register. Once you're there, please enter your email address, double check if it's the right email address, and click on the program that you would like to receive updates. Usually it's childcare, adult senior care, whatever program you wish to receive updates. Again, we are putting this link into the chat for you as well. Next slide, please. Another way to obtain licensing updates and receive important resources is to attend our quarterly childcare provider webinars, just like you're doing right now. These are the dates for the future webinars of 2024. We have one in June 25th, September 24th, December 10th. All begin at 6 p.m. at night. You can register to join these webinars by checking for the upcoming pins to register, and you will receive Zoom invite in your email inbox. Again, please register to attend the future provider webinars. Next slide, please. We are aware that you all have such a busy life, and you probably don't have enough time to participate in these webinars as well. But we also have a lot of ways to support you. And that one of the way is we have videos, we have webinars, we have resources on our CDSS webpage for you to join or click at your fingertip. We have previous statewide childcare licensing webinars, such as Ask the Advocates, tips and tools to support regulatory compliance, safe sleep regulation videos. We have many, many resources upon our DSS website, as well as videos to support you. So please check out our CDSS website at www.cdss.ca.gov and join and click on all the resources that we have within our department website. Next slide, please. At this time, we encourage you to take this moment to complete the survey. We read your responses and value your suggestion to improve these webinars. Based on your survey feedback and ideas, we have made multiple changes to our webinars throughout the year. Please, at this time, use your camera to scan the QR code that is showing on the right side of your screen and take the survey. It is a short survey of about 7-8 questions. We will also be putting in the chat the link to the survey as well. So please do the survey. If you don't have time right now, a survey link will be sent to you via Zoom after this webinar, so you can do the survey. But we do encourage you to please do the survey so we can improve our future webinars. Next slide, please. Thank you for joining us for the presentation portion of this webinar. We will now move to the Q&A portion. This evening, my colleagues Carla and my manager Tracy and my colleague Shoei will be here to assist with the Q&A. We do appreciate you joining us. We also have the Child Care Policy Unit here to assist, as well as all of our guest speakers will be on to answer all of your questions regarding to what they have presented earlier this evening. At this time, we will turn off our PowerPoint and stop the recording.